In Unit 14A.III, we'll be discussing somatoform and dissociative disorders. Somatoform disorders are characterized by physical symptoms such as pain, paralysis, blindness, or deafness, but without any demonstrated physical cause. There's no physical, medical, biological causes for these symptoms. The symptoms are physical, but the causes are completely psychological. No physical damage is actually done. A type of somatoform disorder is called conversion disorder. Somatoform disorder is when your entire body is affected. All right? Conversion disorder is where a specific part or specific organ is affected. The patient will lose control of bodily functions. This happens without any physical damage. Again, it's all psychological. So where do these disorders come from? According to the behavioral approach, it's acquired through classical conditioning and maintained through operant conditioning. According to the cognitive approach, it's misinterpretation of harmless situations as threatening. And according to the biological approach, it's neurotransmitter imbalances. So next, what are dissociative disorders? Dissociative disorder are disorders in which conscious awareness becomes separate from previous memories, thoughts, and feelings. Dissociative identity disorder is a rare dissociative disorder in which a person exhibits two or more distinct and alternating personalities, also known as multiple personality disorder. 4 conditions for dissociative identity disorder. There needs to be a presence of 2 or more distinct personalities. There has to be at least two take control of person's behavior. Inability to recall important personal information and not related to drugs or medical conditions, usually stress or anxiety induced. Generally, individuals who have this disorder are identified initially because of their complained of having lost periods of time during which they apparently were doing something but have no recollection of what they were doing. Long-term psychotherapy is the treatment of choice. Therapy consists in an attempt to uncover trauma. So it's typically induced by trauma. Dissociative identity disorder is rare, very, very rare. Each personality may have its own name, memories, traits, and physical mannerisms. And it may also be different in age, race, gender, and sexual orientation. Multiple personality disorder or dissociation identity disorder alters commonly as you move across cultures and countries. Some of the causes, very little known as to the causes, but some theorists think it's stress-induced. Intentional role-playing may lead to development of multiple personalities. Maybe you might lose your sense of self because you take on the identity of someone else. Media reinforcement might be involved. Most common cause is severe physical, sexual, emotional abuse or rejection, usually during childhood, more likely to occur in females than in males. Controversy, however, only 200 cases before 1970 are known. Now, many run as high as 5% of inpatient hospital admissions, which is thousands into the thousands, if not hundreds of thousands. Some psychologists think this is becoming a cultural phenomenon more than an actual disorder. And that concludes this one.